So would you say, sir, that every woman that gives birth have postpartum issue, one way or two?
Not postpartum mental health issues.
Yes, I'm just saying one of the issues.
Yes, there are many postpartum health issues that we cannot exhaust here. Some people after delivery is when their high blood pressure begins to go up. Yeah. Some it may be after delivery that they begin to have raised blood sugar. Some it may be after delivery they will start bleeding. There are so many issues. That's why we will tell pregnant women after they have delivered, it is never over until it is over. They must come for a checkup and do something. Because some people will relax, they will stop checking. Some will stop their BP drug. Those who have hypertension, and some will not come to the hospital with very bad complications. So after delivery, it is still very important to be on the toes and be checking.
Okay, so my first brother is a medical doctor. Okay. I'm a psychotherapist. Okay. So, but before I got certified, I usually visit him at the hospital when people come for CS, and I realized that the rate of people embracing CS is really high, and I'm still trying to find out is there something responsible for them? Has there been a shift in medical practice in that regard? For me, I don't see anything wrong with it. It's good. People should do it. But I just see that the rate is now really higher than the natural birth. Is there something that we don't know that maybe in the medical field it is known? Because I've asked my brother once and he said it's not everything I'll be telling you, my friend. You
wanted to be a doctor to shortcut.
Yes.
Anyway, you see, the issue of CS rate increasing, there are two ways to it. Okay, sir. I always tell my patient that it is every woman cannot have normal delivery. It's not a cause. CS has saved many lives, both mothers and babies. It is not possible for every woman to have normal. It is not possible. I know people don't like hearing this. And it is part of the reason why we have lost some women and lost some babies. Now, in those days, CS is one of the reasons why the deaths of mothers and babies from pregnancy are drastically reduced. Not the only one. Improved and better antenatal care, improved health services has also caused a reduction. Now, people are becoming more aware of the need to go for antenatal care in urban centers. The rate of baby dying, women dying from CS is still high in the rural areas. And if you go to some part of the country where they don't embrace good health care, nationwide, Nigeria is one of the worst maternal mortality rate worldwide.
Yes, I know.
We are only better than some countries and that world, and it is shameful. Maybe we are better than Sierra Leone, Central African Republic, Somalia, and all those countries. We should not be competing with them at all. They are not good in this. And part of the reasons why this is green, one, people don't go for antenatal care. People, you may think, when we are in redemption camp, we're in Lagos, we have a very wrong perspective that things are rosy. Just go to the inner side of all those settlements around there. Yes, you will see a lot of people delivering in traditional birth attendants, people coming with very bad complications. It's still rife and happening all over there. Now, the rise in CS rate depends on where you are looking at it. If you are looking at it from a specialist hospital, people will be referring patients there. Bad cases from other hospitals will come there. So, like where I also work center, people say our CS rate is high because we're a referral center. True. Surrounding primary health care center, TBAs, they refer back cases to us. So a lot of time when you come and see, you think it's not all the patients that are patient. And also, patients that have very bad high risk in pregnancy, they will refer to specialists. And most of them will do Caesarean section. But the other part to it is also this. People are becoming more enlightened. There are women who come to antenatal clinic. And from antenatal, they will say, Dr. Law, I don't want normal delivery. A patient was telling me one that I witnessed the delivery of my elder sister, and the tear she had was not funny. I don't want that kind of tear. It is CS I want. Exactly. So that's what we call maternal request. Okay. And legally, when a woman requests for CS, it is binding on us. Unless it's requesting at a time that we know, like I've had patients that are 32 weeks. They told me, I'm tired, bring out this baby. I said, no. That's preterm delivery. It is not right. If you insist, I will refer you to go elsewhere. But if she's already 9 months and everything's okay, Dr. Lama won't say, we'll do it for her. It's our preference. Wow. So that maternal request, to a small percent, it might be contributing to the increase. But that is not the only reason, because health care is also improving, and we're getting better outcome.
Yes, thank you so much, Doc. We have discussed, a lot of issues. We have realized that, learned about the causes of infertility, even for men and so on. But when a family realizes that there is problem, maybe afterward they've waited for 1 year or even more than that, who is the right person they need to talk to? Who is the first person they should approach?
So when infertility has been diagnosed by the criteria I've earlier listed, the best specialist doctor to see is a gynecologist. That's the right person. But gynecologists are not everywhere, because any medical doctor has basic training in handling infertility. So if where you are resident, where you live or work, that you can readily get access to a gynecologist, see any well-trained medical doctor. The doctor will be able to guide you on what to do and the next step to take.
Doctor, there's a reason why I'm asking this question, and please, guys, don't laugh at me. There was a time when my wife and we were trusting God for the fruit of the womb, and we went to just see a doctor. And the doctor said, you people go and take vitamin E and all of that. What do you say about that?
Well, that's just a lay, maybe the person approach a layman approach to it. Vitamin E are just like vitamin C, they are just supplement antioxidant. They won't primarily address the cause of the delay.
We didn't know the cause of any delay.
That's why the doctor should have taken time to ask you detail and ask you to do some essential tests.
But do you know what happened? My wife actually got pregnant, and we lost the pregnancy. After losing the pregnancy, we just decided to go on another vitamin E episode. But it didn't happen.
But then you were already available, like you said, more than before. And you are not traveling as frequently.
After taking the vitamin E, I wanted to see the effect of it.
So you were available.
So she got, well, then we lost the pregnancy. Okay. We started taking vitamin E again. I could no longer wait, and the baby didn't show it anymore.
Vitamin E is a non-specific supplement. It's like what we call, just like vitamin C is an antioxidant. Just like, how do I put it now? Let me put it this way. The major cause of malaria is bite by female anopheles mosquito. Yes. But we know that in bushy environment provides a very enabling environment for mosquito to thrive. Now, so when you clear the bushes, mosquitoes will be less, so you have less malaria, bouts of attack of malaria. But clearing of bushes does not kill malaria. I hope you understand what I'm saying. Yeah. But when you clear bushes, because for example, if you're in the US that they don't have female anopheles mosquito species, even if you let your bushes be, you won't have malaria, because those type of mosquito species will not breed there. That's what vitamin E does. Just like mopping up some things that may be disturbing the body system, but they don't primarily address the cause of infertility. We call them antioxidants. For those who are into sciences, which there's something we call free radicals, chemical that can cause damage to cell. So vitamin E, vitamin C, vitamin A, they will just pick up those. They are not specific. Pick up all those like irritant, disturbing. Leave this system alone. But they are not like a specific treatment for cause of infertility. Most times I don't give my clients. I don't even use it.
Interesting. So the next question I would like to ask is, how does adoption work in Nigeria?
Yeah, adoption, is a.
Can you add surrogacy to it, so you just have that together?
Adoption is majorly a legal thing, because and in Nigeria it's not easy to. They make it somehow difficult. You have to go to the Ministry of Women and Child Affairs. So depending on different states, the intending couple who want to adopt a child will be subjected to some tests, and even at that, a lot of people that come to they find it quite difficult. It's like the way our country works. It's more of
bureaucratic bottlenecks,
so
kickbacks.
Well, I understand the reason why the government should be concerned about this, because you don't go and give a child to ritualists, all those things.
Exactly.
But they have to take due process and be sure who are they giving the child to, know the environment, are they capable financial and that to take care of the child, do they have any condition that may impact on the. But despite that, it's still a lot of couples is a lot difficult for them to get babies to adopt, and there are many children who need to be adopted in the country. But people succeed in getting children to adopt, but a lot of people lament that they pass through.
Where do we go?
Usually it's Ministry of, I think Ogun State is Ministry of Women and Child Affairs that handle that. You go through them, but people still complain that is difficult, but people still get children to adopt. But it's because the extended family system is collapsing. We have our own traditional method of adoption. Like when we are growing up, our parents does not need nannies. Most time after you have been breastfed by your mom, they might not even see you till evening. You are whether one cousin, one auntie has back where I go, she's enjoying her life and the stress is less. And in the extended family, we have aunties and people who don't have children too. So they will pick any of the children of the. Correct. Some will even raise them from beginning at their home. Exactly. And it found a way of reducing the tension of infertility. But now everybody has become mind your business. Exactly. That traditional adoption is not really, nobody is even willing to release their child again. Yeah. So adoption still works. There are lawyers and people who are very fast in how to help people to get this. But anybody that wants to go for adoption must go through the legal channels to avoid issues. Now regarding surrogacy just means you are using another woman to carry baby. Generally, in relation to IVF, some women cannot carry their own baby for so many reasons. One common reason may be they have very bad womb. There's some people maybe in the days when they are young, they have had abortion, they went for D&C. Some their womb were completely damaged. We have had women that have to remove their womb from the process of that abortion process. The womb is completely gone and they have very good ovaries. So what surrogacy entails, another willing woman who is the surrogate will carry the baby. They will sign a legal contract. The egg will still come from the woman if the woman is still good to produce good eggs. The sperm will still come from the husband. They will fertilize the egg and the baby, and then the woman will just carry. Genetically, the baby does not belong to the surrogate. And they just a carrier. And there will be a legal contract already signed. One surrogate that manage immediately twins, immediately the woman deliver, the parent carry the baby away from so that there will not be bonding. No emotional attachment that I want to see my babies. They are not our babies. A legal contract has been signed. Other reasons why some people opt for surrogacy. Women have health issues. Some people have some health challenges that pregnancy will threaten their life. That I may just advise them is not good. For instance, some sickness. I've had a patient, one of my patients, I told that don't get pregnant again because I lost several pregnant, one that God help us to manage the deliver. For the sake of your life, go and get the surrogate. They can still use her egg, her husband's sperm, a surrogate will carry. And there are some other women that for so many reasons they be having recurrent miscarriage. They will get pregnant 3-4 months, it will come down. And we have done a lot of medical things still happening. Just say, good, you still have good eggs, let another woman carry this baby for you. So that's the principle of surrogacy. But it's more expensive because you have to pay the surrogate. Okay. And there are some agencies that help them get surrogates.
So you mentioned miscarriages. What are the causes of miscarriages?
That is very wide.
Okay, I think why don't we do this? We'll go on a short break right now. A big thank you, sir, for all that you've shared. We'll be going on a short break right now, and when we come back, of course, we'll be getting to learn more. It's still the Happy Family Podcast, and we'll be right back. Welcome back. It's still the Happy Family Podcast, and of course, we still have our dearly beloved guest, Dr. Olaomo, in the house, and he has shared so much. I feel like I just went to medical school. I just graduated from medical school. I've learned so much about childbearing issues, and the truth is, there is still so much more. But before we delve into the question that was asked before we went on that break, we would like to introduce, of course, a member of the family who just slipped in, and because there is so much she also has to contribute to the family. Yes, let's welcome to the house family member Sarah Sassy.
You're in the patra. Yeah.
Welcome aboard.
Thank you, sir.
Trust you're good.
Yes, sir.
All right. Yes, so of course, we'll be talking about childbearing issues. We would love to delve into that question that was asked by Olabisi.
I actually still want to give birth to more.
Really? After 4 children?
She told you.
Olabisi, how
she told you?
I can hear her mind. I can hear her mind.
Okay. All right.
Starting with 4 will not be bad. 4 babies.
Yay! You see, Dr. Laomo is a good family member. All right, RBC, you asked a question before we went on that break. We would love you to ask that question again.
Thank you.
Yes, we'd love to hear it.
So, Doctor, picking from where we stopped, I asked a question. What are the causes of miscarriages?
Okay, let me first start with, to a lay person, abortion is different from miscarriage. But medically, they mean the same thing.
Wow, I'm just learning that.
Now, when we talk of miscarriage, that means pregnancy that is lost before the baby becomes viable. Now, when we talk of viability, in our setting, we use 28 weeks. Now, any pregnancy lost before the baby is up to 28 weeks is abortion, is miscarriage. In Nigeria and most of Africa. But when you go to developed countries, they see, because they have advanced healthcare system to take care of those preterm, so they may use before 22 weeks or 24 weeks. Now, for us to be able to understand, generally speaking, most miscarriages occur in the first 3 months, the first trimester, what we call trimester. And most miscarriages that happen in the first trimester are usually because there's issue with the baby, what we call genetic problem. Like a natural way of the body weeding off bad babies. So most miscarriages in the first 3 months actually has to do maybe issue with the baby, genetic problem, chromosomal, remember biology, chromosome genes, chromosomal problem with the baby. But there are a lot of other things that can also cause miscarriages. It can be health conditions of the mother. Some mothers who are diabetic, not well controlled. Mothers who have high blood pressure, not well controlled. They can also cause miscarriage. There are some other medical health conditions. Those who have problems with their thyroid glands. Thyroid is what is in their neck. If it is so bad, whether it is functioning too high or too low, can also cause miscarriage. And in Nigeria, medications are not regulated. You can get any antibiotics, any drug over the counter in Nigeria. It's not so developed. Drug abuse, not only cocaine, there are some medication that a pregnant woman should not take. It can also contribute to miscarriage. And in some other instances, the cause of the miscarriage might be unknown. Common diseases like even malaria can cause miscarriage if not properly treated. So these are some of the common causes of miscarriage in the first 3 months. There is another cause of miscarriages. There are some women, when they get pregnant, the pregnancy is approaching 3, 4, 5 months, they will just discover that the seawater baby will be dropped. That's what we call cervical incompetence. Don't mind the big grammar, I'm going to break it down. Now, the neck of the cervix actually means neck in the Latin where it is originated from. Just like our head and neck, the head, the neck. The womb too has the cervix. The cervix is the neck of the womb. It is the one that carries the womb. Now, when the carrier of the womb, which is the cervix, is weak, the weakness can be from many causes. The common reason for a lot of women who have had a lot of D&C, they have had a lot of them before they start, they could have injured the cervix.
Sorry, sir. D&C, that's abortion. Abortion, that's the word for abortion, yes.
So, the lactation created. So, a lot of women, if they have done it and they get to injure the cervix might have become weak. So, as the pregnancy advances, getting to about 3, 4, 5 months, the cervix will not be strong enough to carry and there will be miscarriage. Some women are born with the cervix that is weak. The muscle and everything are not just weak, they can have miscarriage. Some other women after delivery, they can have tear. Women have tear during delivery. Some can have tear of the cervix, because that's where the baby passes out from. So if the repair is not well done or the tear is quite bad, subsequently they may begin to have cervical incompetence, meaning cervical insufficiency, cervical weakness, and that will be leading to miscarriage in the second trimester from 4, 5, 6 months. The way we treat that is just to, during pregnancy, we tie the cervix. We call it cervical sacrilege, cervical stitch. So those are generally a lot of the common causes. There are some other causes of miscarriage that may not bother to go into, but those are the general common causes of miscarriage.
Okay, so still on that.
For it to be detected early so that something can be done. Because
exactly.
Aunties had an issue, so they had to tie it.
That's
tying now. Now I know the tying.
And
the baby I'm talking about 21 years old.
There are several babies, even in camp and around there, that's what God has used to save their babies.
Wow, sustain them. Wow.
And that is why preconception care is important. Some women will come in, it's already too late to put that stitch. But if they come before pregnancy, we already know their history, we counsel them. And you know how people, some will still run away where they have faith. I have a patient now, she lost the first one. They refer her to me and I told her, you will do this cervical stitch. And she has been around that time, she just ran away with her faith. You know, at the point, I just left her alone. One day she was just calling me, coming from Lagos. I'm seeing what I said, madam. As he called, the doctors called me, please refer her to another hospital because it's too late. She lost the pregnancy. After now having another pregnancy, that's when she now became sober. We have done the cycle and she has carried it to 9 months now. So it's
okay,
good,
sir.
Simple things to.
Thank you, Daddy. Yeah. Still on that, I remember you saying drug abuse. And you know, in Nigeria, so many women, especially in the rural areas, they feel that healthcare is expensive. Some of them, they've not even entered the hospital surrounding before to find out if it's actually expensive. And you see them abusing drugs to the extent they go into herbal treatment. Now, how does herbal treatment affect women, especially in pregnancy?
Yes, I'm one of the doctors are always advocating against herbal and alternative medicine abuse. I want us to take note of that abuse because a lot of medications are made from herbs. Like for quinine, it's from herb. Artesunate, that's very popular, is from herbs. But they'll be able to separate the wheat from the wheat. So we understand because it's not when you like now. I was born in the village and in God's mercy bring us to where we get. We were no antenatal care, no immunization, but we survived by God's mercy.
That's where I was going.
So, but that does not mean we should encourage because some people were not that fortunate. They were lost in the process. And those days when we have malaria and this, like this good they call don't go around mango. At times they will cook it, and now those drugs truly those leaves may have some active ingredients that are actually working against malaria, but not that everything we are boiling. If you observe that there has been an increase in the cases of kidney problem, liver problem, unrestricted, unregulated use of herbal products is contributing to that. Is one of the, apart from high blood pressure, diabetes, herbal drug abuse is one of the leading contributor to these diseases. So herbal drugs, and another challenge with herbal drugs is that they always make claims that are not verified. Go and look at a lot of these herbal drugs. They say cure high blood pressure, cure diabetes, cure pile.
10 illnesses at the same time.
Drug will cure 20.
Yes, and the proper dose are not usually well stipulated.
What about the bitters? The bitters that I don't want to mention names.
I know that. I don't want to. Another scam that is going on now. They will tell you should detoxify your system. It's a lie. What detoxify our system is the kidney. Once your kidneys and liver are in good shape, a lot of things will be detoxified. Now, some of these herbal products are now abused, are also adding more injury to the liver and the kidney. Herbal drugs that have been proven to be effective, but they have been subjected to proper scientific and medical research. Artesunate, Chinese were using artesunate product to treat malaria for years. But over here, it has been well studied, regulated, and we have extracted what is necessary, and is one of the best anti-malaria we have around. So herbs are wonderful and good for the treatment of disease, but not the way we are abusing them and the way they are doing them for our health good. And especially pregnant women should be careful, especially in the first 3 months. That is when the foundation of the baby is being laid, foundation for the heart, foundation for the liver, for the leg. So anything abuse can lead to serious congenital problem in the baby.
That's why we have some deformed children coming out with this and that.
Okay, please, ladies first.
All right, so I've seen a scenario where a woman is pregnant for the past 3-4 months. She's still menstruating. Is that safe for the woman? Is it safe for you to be pregnant and be menstruating at the same time? Because for me, I'm supposed to be pregnant and I shouldn't be seeing my menstruation. But some women are pregnant, but they're still menstruating. Is that normal?
Now, the first fact is that a pregnant woman does not menstruate. A pregnant woman that is seeing blood is bleeding. Because a pregnancy means the menses stop at that time. But a pregnant woman can be bleeding, it's no menses. A lot of women make that mistake and say it's my menses. Once you have been confirmed pregnant, such a woman does not menstruate. She's bleeding and many things can be responsible. One of the commonest symptoms of miscarriage when it starts is bleeding. And there are some pregnant women that have something in their cervix, not even be pregnant, that making them to bleed. Some women will have growth around the neck of the cervix that is making them to bleed. So some other women, a pregnant woman can also have cervical cancer. It happens. It can happen together. And one of the commonest symptoms of cervical cancer is bleeding. So when a pregnant woman is bleeding, she is not menstruating. There is a problem that she needs to see a gynecologist so that we know what is causing the bleeding. So
two things in one for me. I'd like to find out about for couples that want to have children, what kind of lubricant is safe for them to use. Okay. Once you're done with that, I'll ask the next question.
Now, for the couple to need lubricant, that means there's an issue with lubrication. The woman does not get wet adequately, because there's a natural mechanism that God has put in place for the act of sex. Once the woman is stimulated, there are glands. If you remember biology, glands are special endocrine that produce fluid, they produce hormone and all this. That produce special fluid that will lubricate the place. So that most time during intercourse, lubricant will not be needed. But I am aware there are challenges at times. For one reason or the other, some women don't like sex. They don't get easily aroused. They don't get wet, and that will make sex painful. There are lubricants that can be used. But they must be, if they are looking for babies, they must be certain that it's not lubricant that has spermicides. Spermicides are chemicals that kill sperms.
So how would they know?
No, when you go to the market, like KY jelly does not contain spermicide.
KY jelly.
KY jelly. And there are anyway, so that they won't say I'm marketing their product. They are not paid for adverts.
I want to say something which you're saying.
Yes.
All right. You're saying that, okay, maybe because it's clinical surrounding that, but I think the man also have a work to do concerning the woman getting wet.
Yeah, that's foreplay.
Right?
The role of foreplay. I understand.
The role.
Okay.
So I think a man has.
I was once in a meeting where couples were there, so we broke out into rooms to say, guys talk, ladies talk, and then one guy just went up there and do that. Any leader, they are so desirable. Just I can't be priming you, that me too. I want to be prime yourself. I prime myself. Get ready and we go. I said that's how they have to have that conversation for them to have their children. And then most of the guys in that room now also said, those foreplay things is not really what they want to do. Everybody should get themselves ready. And it begins to give me a conclusion that foreplay is for your own benefit, not for our own.
The thing is that there's something men should know. Like for this age, these women of this age, they are working class women majorly. Now a woman goes to work and come home and is stressed out. She does the chores and the average woman, if she doesn't have help, she does the chores and everything. And at night, this woman is tired and weird and wants to sleep, right? And then something wants to happen that night and she's not getting wet. Do you think that stress can contribute, especially if the husband is avoiding that foreplay?
You see, in this our generation, the problem is both parties. Because I have seen instances where the woman wants to, especially when they're looking for children, but the men say, just leave me alone. And in fact, especially with Lagos traffic.
Thank you.
So it's both ways. But in that instance, I agree a lot of men who are worked out, they may not have the patience for foreplay. But that's both of them need to discuss.
Yeah.
Because some women may not need much of stimulation, and they also need to be told a faster expressway to where they're going. For instance, now everybody's an adult here.
Yes.
One of the, what is it, Jensen, we call it G area, G spot, or what they call it?
G spot,
G spot.
So we know that the clitoris, the clitoris of the woman is one of the most sensitive parts. We can get a woman aroused faster. So if the woman play with the clitoris, sensitize the clitoris, the woman is likely to be in the mind and get.
Why are you thinking that? Why are you thinking that? She's learning for two.
And get wet faster than other area. And there are some other women. Some women know where they. I had the patient one time. She had this what we call galactoria, milk coming from the breast when she's not pregnant on breastfeeding. So some people will say maybe stimulation from their husband from the breast will make the water to come out faster. But when we give good medication, that can bypass that. Now I was asking her that is it true that your husband is always, can you leave that for a moment for that thing to improve? And she told me that that's the only way she gets aroused. When her husband play with her nipple and play with her. And I said, now we can't stop that. Don't worry, there are medications that will tackle the issue.
Okay.
So because that woman said that's the only time and the fastest route for her to be aroused, and both of them have understood that. So that means even the man is tired and he already know the express way to his wife. By the time
Shortcut.
the shortcut. So
Please understand.
the two partners have to come to the table, discuss
communication.
And I always tell
the dining table.
Yeah, I always tell couples
Dining
too.
table.
There is nowhere it is written that sex must be at night. Is there anywhere it is written?
At all.
No. Because a lot of couples have that mindset that is when we want to sleep. So if both of you are tired
In darkness.
In darkness, with the lights off.
if both of you are tired at night, both of you early in the morning before you go to work and you're afraid, is it written somewhere that can be done?
Early in the morning is also better, sir, because I think it makes your mind
You
refresh.
You reflect.
You come alive.
Come alive. Thank you.
You can become an achiever.
Much more alive
In the morning with
Well, men are easier to manipulate, so
Yeah.
alive anytime. Then that's why the reason for flexibility, like some couples who are infertility, I have quite in some of them. One of them is doing night shift. It's when the other is coming, the other is leaving. And I told them, you see, laws are made for men and not made for the law. Now you live where you work around the same vicinity in camp or area. During your working hour, you can beg for break, 30 minutes. You want to get something. Your husband is at work, he's at home. He will only go to work. Beg your boss, now please give me 30 minutes. Go and meet him at home and do what you
And
do.
do the
And it's at
needful.
work.
Oh.
Yeah.
So
Do the
it work for
needful.
them. They have babies. So the point is, if the parties want to solve the problem, there will always be a way.
Yeah.
It's only when
I think that's very deep.
Yes.
If the parties
Want
want
to
to solve the problem.
But both parties must be willing. But anytime there is a barrier, you don't want to solve the problem will pass.
There's something that you said which you stuck to. That is, I think you've been fighting for both the parties.
Yes.
Literally, like it takes two,
Yeah.
not just one person.
Takes two to tango.
And that's a good place to be.
It takes two.
Thank you so much, sir. Thank you so much. So I want to ask, is there family planning available for men?
Vasectomy.
I am a number one.
Because I've read about it.
Really?
Yes. I mean, no, please let us not cross fire. Let's not create problems.
Let's
Let's not create problems.
Yeah, the first person I'm saying, but that's because as much as they're advocating for women to get family planning, they are not doing that to men.
I know. Men have to go find this out.
Why?
I had a friend that wanted to go for it, and then they asked him to come into therapy first, so that his mind can be prepared, for the procedure, which he did. For 3 months was in therapy. We were telling him, okay, what to do, how to go about it, and when he was ready to do it, they did. But that thing, is all sort of.
So is it advisable? Is
it advisable for men?
I will address it in two ways. You see, a group of doctors, I think they conducted a research, and they discovered that it's even the women that don't want their husband to do vasectomy.
Why?
Yeah, you see, when the ships are down and you analyze, you may discover that is your wife that will later say, And these are the reasons. One, some women, if they are not Christian, believe that will give free license to their husband to start playing away game.
Okay.
Because you see, when the chips are down, women are wonderful.
Very wonderful. You can say that. Very. You can say that.
Very wonderful. So women believe that will now be. That means
If he does anything outside, nobody will know anything.
Extramarital Peking coming home. Secondly, some women will be, what if our financial status improves and I still feel like having one more? No, IVF can always solve that problem. Now that's one. But secondly, truly I agree that men should also have family planning method. But this is what I tell women: men don't get pregnant. It is risky to leave your health, your life, your reproductive future on the hand of men. Because a lot of men will say, sorry, I forgot, and you're already pregnant. What will you do? You beat him. Because you see, one of the ways to prevent women from dying from pregnancy is to prevent pregnancy. That is the best pregnancy.
Prevention, yeah.
Men don't do CS. Men don't bleed from pregnancy. Men don't bleed to death from after delivery. Men don't have hypertensive disorders in pregnancy. So I tell you, I agree with your cause. Men too should do family planning. But that means you'll be putting your faith on his being faithful to those medications. Though there are a lot of researches going on to see medications and things that men can use.
What about the surgical procedure? Okay.
I will talk about
Okay, all right.
So, but the first 3 remain, even when they are available. Not every man, even myself, If you are tired, if the drug is giving you some funny thing, you will drop it one side. It's until when your wife now say, I'm feeling nauseated, I'm for me. What happened? I get belly. The man will not be pregnant. It is true we should also look for men, but we should look at it that it may be risky for you to actually put the risk of you not getting pregnant or getting pregnant on your man. Because men can be men. Abi?
Yes.
Yes.
Sorry.
Two things are.
No, he has one more thing. No, doctor is not done. Doctor is not done. Yes.
Okay.
I know there are other options for men to do.
Yes. Now, the only available option that we are using readily is the surgical option, the permanent method. Whereby, like I said earlier, men have a pair of tubes, women also have a pair of tubes. The fallopian tube, the spermatic duct. The way we can cut and tie both, and it's permanent. But one thing, when a man does, if you tie the fallopian tubes of a woman today, it starts becoming effective immediately. No pregnancy. Because the tubes are blocked, sperm and head cannot. But a man, even after we have tied the spermatic duct, it takes 3 months at least. So if you think they have tied your husband to today and you open up, you can get pregnant. That's why I say men is a never-ending well. It is always coming. And then after that 3 months, you must still do sperm count to be sure there's no
sperm.
There's no leakage.
No leakage.
So when we do what we call vasectomy, they must be using condom for the next 3 months.
Wow.
And then we must do sperm count, 3 consecutive ones that have confirmed that yes, there's no sperm there. Otherwise, so that you won't come to the hospital and sue Dr. Lam. This baby you pay school fees for it.
Okay.
So is there another option to
my wife was telling me this recently that there was a new development. I don't know. I tried searching. Yes, she said that is not surgical braced for men.
Now,
so I don't know.
Vasectomy, the traditional ones that we do surgery, we remove, we cut and tie. But there are clips they use now. Maybe that's what she's referring to. That the spermatic duct will just be clipped with tiny clip. So if you are ready, you want that they can remove the clip. But we always advise vasectomy, bilateral tubal ligation, that's the tying the tubes of women. They are permanent methods. The way we do it here, any person that wants to opt for it must think about it well, because it is irreversible. And what I do, it is assumed to be irreversible. There is no method that cannot fail, but they really fail when properly done. But the clip that's available now, even for women, they can put clip on the fallopian tube. Those clips, their own failure rate are higher than the traditional one we do surgically, cut and tie. That one.
But the clip for the men, is it external or internal?
No, they will still have to go through the skin.
Oh,
but
the
cut might be negligible, tiny thing that you may not.
Okay, not okay.
So the reason why I have a reservation about it is, so I have someone that did it at a time. A man, and then they had a tragedy. They had an accident as a family. The children died and the wife. So it was supposed to restart life again, and it became so challenging. So that's why I feel that in a way, if as a man you can't control yourself, it is sort of insurance that in case something horrible happens in the future, you can still want to have.
What of the other way around, which affects the woman?
So that's why I don't really support the permanent things.
That's personal.
But the man can still have children if he has money.
That's what he said. IVF. You still have the sperm are there.
Okay.
You can still have the sperm. The only thing they aspirate it.
In vitro.
They'll aspirate it.
Yeah, from the testis.
That's what he said. That's what he
Once
said.
They'll shoot his testis.
Sorry, that means there's a possibility of family planning failing and all that.
Yes, any
Because I've
family.
seen cases where a woman will say,
Family planning
I was in
I don't
family
want
planning,
mine
and at
doesn't
the end
fail.
of the day, I'm pregnant.
Mine doesn't fail.
So what causes that?
Family planning, there is no family planning that will cook for you 100%. But most of them are 99.99 something percent.
So
you know, as a doctor, we won't give you 100%. Even that permanent one, we say 99.998. It's only God I can tell you 100%. But those permanent methods, when properly done, they really fail. I've done several bilateral tubal ligation for women. Yeah, I've not seen anyone that come back that has failed. But I don't tell any of them that is 100%. There's that room. Maybe God can make a way in the Red Sea for you, so that you won't come and sue Dr. La won't fulfill you. But they really fail.
Okay, doctor. One more question from me. It can be controversial. Please permit me. Okay, I hear these stories of women having challenges at home with their husband after childbirth. The husband starts saying, oh, my wife's vagina is no more
loose.
tight, it's loose, and that gives them the leverage to start looking for women elsewhere. Is that medically true? Can a woman after childbirth lose the elasticity, should I call it? I don't know the medical term.
Yes.
The elasticity of the vagina.
That's very true.
Wow.
Yeah. So, but now that is why they say that it's good to marry a kind and faithful man. But that one is that's why we pray that God should. But in any relationship, challenges arise. This particular challenge is particularly common in the other side of in the north. A colleague they divorced their wife because of that. If the place has become loose, they will just let. And there are surgery we do, we call it vaginoplasty. If it's causing distress for the some perception of loose vagina is subjective, it's not there. I had a patient recently came to me and that doctor brought a young beautiful lady saying the place is loose. She feels that's why her husband is going out being unfit. I examined the place is not loose anything. But it's causing her a lot of psychological distress.
Okay.
And I said, well, because of this psychological distress, we do it for you, we tighten it for you. Right away we call it vaginoplasty. But when she was given the bill, she ran away. You know, at times money can cause distress. The psychological distress.
Okay, money cured that.
Yeah.
Okay. Before we call this a day, we have a request. From one of our family members, not on CK, that would want an answer to this, and that's about abortion. Multiple abortions. What risk do such a person have when it's time to start bearing children? What risks are there?
So I will start because I'm a Christian and I believe in the Bible. Abortion is not a family planning method. I don't support abortion. You know, as a gynecologist, even when I was serving, there will be several requests pursuing. You know where I started. They say, doc. At times they will call me on phone. You think it's something serious. They say they miss their present. Now me cause you to miss that. That's what they tell me. So you see, that is why for those who are not yet married, abstinence is still the best. But you know, abortion is not limited to the single. Even a lot of times it's the married that are requesting for abortion the most.
Yes.
And that's why we advocate they use family planning. You know, there is a lot of stories surrounding family planning that are not true. I agree too late there are side effects. Even food has side effects. When we talk of people that they have too much cholesterol in their body, where did they get it from? It's not majorly from their diet. When we talk of all these, a lot of health conditions has to do with food. But why are we still taking the food? I used to challenge some of my patients. If you have diabetes, maybe because of your junk, a lot of junk you have eaten, you stop eating food. What you are going to do is to look for other healthier food you'll be taking. But you know, because our people don't like to use medications, they will look for excuse to run away. Foods are chemicals, drugs are chemicals. For those of us that do sciences, when we are drawing structures of food, carbohydrates, protein, if you remember those who did science, you say N, C, oxygen, carbon, hydrogen. When we draw the structure of all these drugs too, that's how we draw them. When we call organic and inorganic chemistry. And not all food are also natural. Is Indomie natural? Is it not? So
process.
Yes, process. I'm saying this that people, we should take our health with seriousness. Family planning, yes, there are side effects. That is why there are options. Our wives use family planning, doctors use family planning. So if this one is disturbing you, is not okay for you, you can opt for the other one. Now, abortion has a lot of issues. Part of the issue I've mentioned, those if it's not properly done, or I won't use the word properly done, there are complications. Some of them can have cervical incompetence from repeated and serial examination. Two, some people can have complications like infections. Now, the leading cause of fallopian tube blockage is sexually transmitted disease and complications of abortion. You know, from abortion, most places where abortions are done, they are not well trained. They are from quack, joints, chemists. They will come down with infections, and when infection sets in, the fallopian tube is very tiny. It's very prone to all this. The fallopian tube become blocked. and they will not be running around with infertility. Some can come down with abscess, pus in their tummy. We have a patient that we have to do surgery to drain pus from abortion. Some women have lost their womb from abortion too. I've had patients like that we have to remove the womb, we can't salvage the womb. So in the long run, if you are not ready for baby, old body, it's possible.
Yes.
I'm married.
There's this question I want to ask. Do you need to do tests? Before you go in for family planning, do you need to run a test to know which family planning is good for you or not?
So that's why
because I've seen most people just walk into the hospital and I want to do family planning, and they just
put one for them.
Yes.
We have family in most hospitals. They have family planning clinic. So when you go there, they will sit you down, ask you questions from your history, your medical history, and family history. Because for instance, there's a particular method. If there's a very strong family history of breast cancer of the cervix, we will discourage the woman from using it. So when they ask all this, not that drug really will directly cause cancer, but it might increase the risk. So when we interact with you, about the patient that I wanted to place her on that pill for another thing. Very strong family history of breast cancer. Mother is a breast cancer survivor. Her auntie, about 3 of them, the same strong first degree family. I just have to wait, madam, give me my drug. This is not the best for you. You look for another alternative. And at times we may need to do some tests, but when you go to a good family planning and they have interacted with you, they'll be able to guide you on the one to choose.
All right, thank you very much, Papi Sam. Time don't run out.
Honestly,
this is
just a quick one, and we call it a day. All right.
So I want to find out, you're a believer. Where does faith meet medical practice for you, and how?
Thank God to that question. Yes, thank God.
How have you been able to walk around it, around your medical knowledge in childbearing and faith in childbearing?
Yes.
Thank you so much. As you are looking at me, I'm a miracle. Let's say that. I was born, maybe a village that has about 10 hot mud houses. No antenatal care, no immunization until we relocated to our bigger town. You know, those they used to give this immunization with gum. It look like those petrol. They will hold you, give you your, and we survive. That's a miracle by itself. And some other life experience I've had, that miracle exists. But there is where, especially we Christians, usually have an issue. I used to throw this question open to people that when our Lord Jesus Christ was in the world, he was riding donkey and horses, walking on the leg and sheep. There were no cars, no aeroplane. But now we are very easily ready to buy cars and aeroplane and reject medical intervention when it's because we feel it's against faith. The same medical and technology knowledge that brought aeroplane, cars, computer is the same one that brought medical advancement. For instance, now Deuteronomy 29:29 says the hidden things belong unto God, but those things that are revealed to us are for us and our children to benefit with, so that we can fulfill the word of this law. What is the word of this Lord? 3 John verse 2, beloved, I wish above all things that you may prosper and live in it. Now, wisdom is profitable to direct. Exactly. Medical knowledge is from God. Because there are a lot of things that we don't have knowledge about it. For instance, many years ago, TB, they used to call it consumption. That tuberculosis. And it's like a death sentence. Once they have it, people will die. But now, if somebody died from TB, it must be extremely dependent and careless. God is almost curable. In those days, they still have a leprosy colony now, lepers colony. Yeah. They used to treat TB like that, but TB now is almost curable. But if you now have a Christian that believes, no, my faith will make me, I won't use TB drug, and the person dies, it will be foolishness. Because medicine and faith, they are not parallel lines. They work together. Even for the medication to work and be effective, you need to pray. When you are going to the hospital, you need to pray that there will not be medical error. Medical error happens worldwide. Not only if you go and check the record in the US, they even amputate wrong leg at time in the church. It happens even in the UK. It happens there. So that is why you need God. Medicine and faith are the same. I've been able to marry together because I tell my patient no. There are times I will just tell one of my patients, come, it is time for you to deliver. No, not that it's preterm. I will say, madam, please let's do. At times I say, man, we will be able to fully explain why. But after delivery, we will not see reason why. So that is the input of maybe the Holy Spirit is pushing you, this woman. But some patient will be arguing with you. I've had an experience like that. I had strong conviction that she should not go to labor, but there's no medical reason for it. So I try every repeated scan that will not say, and the person is medically knowledgeable. They know, what do you want me to do? Say, and I surrendered. The outcome was not nice. So one of my colleagues was not telling me, what do you want? Even in a court of law, how will I justify?
Yes.
But so to know that we are Christian and we're led by the Spirit. But I want to pass this message to my Christian community.
Love this. All right.
Now, medicine is not against faith. They work together. Because God has given us the herbs and the leaf for the healing of the nations. And those herbs, science over the year, biochemistry, medical have studied their component to know what they have to work. So, because I see people, they will be diagnosed with disease and they will decide they will run away from hospital until they are dead. It doesn't take God 1 second to perform a miracle. And I will cite 2 examples. This patient, I told them, let me quickly, I will cite 3, that if they go and share their testimony, I will join them. There's a patient that have done fibroid surgery and the extent of the surgery. I told her when you get pregnant, your next delivery will be by 6. And the woman did not argue, very obedient patient. But labor started suddenly. And she came to the hospital. So I assembled the theater team. We rushed there. By the time we get there, I saw the baby already come. I said, everybody wait. She delivered the baby.
Naturally.
Wow. I thank you, madam. Go and share that. I support you did not disobey us. We have fixed a date. The labor started before, and she was running to the hospital. Said, this is God. But I've had several patients that will run away from that day and will not call. Some lost their life, some lost their babies. If God wants to perform miracle, it doesn't take eternity. Why? And like Yoruba people will say, actually, you will be late to marry. You cannot box God in the corner. I want it now.
Yes, exactly.
No. There have been patients we have taken to the theater on the table and they deliver there before we even carry knife. They don't. Some will not argue. Let's go and on the table. This is the baby coming. Hold on, come out. Wow. So please, so that we won't be having unnecessary complication, death, even come back witness that pain, people running away. Dr. Lam says is going to do for me. They will run away. They will not come with complications. And some of them, it wasn't even CS we were planning initially. Some just induce. Some people will tell them when they induce you, they are deceiving you. It's a gateway to the CS. They will now run to the extent that when they come back, the only option left
is the CS eventually.
Yeah. So
wow.
Please,
a big thank you. Now, man, I don't know what to say. Sincerely, this episode and the load of information I have gotten, I feel like a doctor right now. Don't put a doctor to my name. You're Dr. Topes. Thank you so much, sir, for being a blessing and for sharing all that you shared. The truth is, from that fountain, there is still so much more. I mean, you are. Yeah, there's still so much more. There's still so much more. I believe in the nearest future we'll be having you aboard again so that you can be a great blessing, to our work and to our family members. Thank you for keeping it real, man. And to you watching, a big thank you for being a part of the Happy Family Podcast. I want to believe that you've learned a lot and that you will apply what you've learned. Yes, at this point in time, we are bringing this episode to a close. Kindly remember to subscribe to our YouTube channel, like, comment, share, and also click on the notification button so that you can be notified of our latest content. At this point in time, we call it a day. God bless you. Have a wonderful time. Happy people.
Happy family.
Yeah.